questions. And the next presentation, and the third one for this morning, will be themed Embracing Aged, Fend Out Falls. And we call upon Dr. Harsha Gunasekara, specialist family physician from Base Hospital, Watupitiwala, and Dr. Malkanthi Galhena, President, Sri Lanka College of Specialist Family Physicians, to introduce, I beg your pardon. Along with Dr. Harsha Gunasekara, I call upon Dr. K. Arulananda, specialist family physician and senior lecturer from the Eastern University of Sri Lanka, to introduce the speaker and to take over the proceedings.
Good morning, everyone. It's our great, distinct pleasure to introduce Dr. Asela Anthony, our colleague, and serving as a consultant family physician and senior lecturer in family medicine at the Faculty of Medicine, University of Colombo. Dr. Anthony's qualifications emphasis on MBBS and MD in family medicine, complemented by additional credentials, including diploma in family medicine, diplomas in occupational health and safety, aviation medicine, MRCGP International and MCGP. Moreover, Dr. Anthony is a member of the Board of Studies of Family Medicine in PGIM, while also assuming the responsibilities of convey of both the humanities, society and professionalism stream alongside with the Rural Health Research Center. His invaluable contribution extended to the guiding and mentoring both undergraduate and postgraduate trainees and making him an asset to our academic community. And over to you, Asela.
Thank you very much for that kind introduction. Okay, so I have been promoted up from afternoon to morning. Right, so, okay. The topic is embracing age and fend off falls. We are all aging day by day, right? And we are approaching the age we don't know where we are going to fall. So I will try to take you all through some facts and figures and what to do to safeguard ourselves as well as safeguard our patients. So this is my outline and definition. It is defined by the WHO as fall is defined as an event which results in a person coming to rest inadvertently, which is a very important word, on the ground or floor or another level. So this is not an accident where something else has come and hit the person. The person inadvertently has fallen. If we look at international research, WHO Global Report on Falls Prevention in Old Age, 2017, they have stated that people aged 65 and over had fallen, the percentage as 28 to 35%. And out of them, over 70, 32 to 42%. So it's obvious that falls are increasing with age. Also, older people living in nursing homes falls more often than those who are living in the community. I think this is because in nursing homes, they are more maybe feeble, they might have other diseases. And people who are at home are more fitter and they are doing their own things. And so I think those who have elderly people at home will know they engage in family activities, look after children, so they are better off than people in the nursing homes. Also, approximately 30 to 50% of people living in long-term care institutions fall each year, and 40% of them experience recurrent falls. As you all know, if someone falls, they are more prone to have another fall, right? So, by looking at this, when we all age, I am sure a few of us are going to be in this situation. So, if we think about us, we have to take steps now itself to prevent, which we will discuss later. Again, this is from CDC. They say 20% of the falls cause serious injuries such as broken bones and head injury. So 1 out of 5 falls is a major issue, right? I'm sure that you all have seen, you all have maybe your kith and kin who have fallen and had a hip fracture, maybe a wrist fracture, right? So they fall in under this category. These are from the US. Each year, 3 million older people are treated in emergency departments for all falls. Actually, this is a big burden on the health sector because it is not analyzed specifically because everything goes under the financial cost is not analyzed, but it's huge because when someone goes into hospital, they are there for, say, hip fracture, they are for a week or 2, and then you need implants, a lot of care, they are bedbound, all that. More than 90% of 5% of hip fractures are caused by falls, as I discussed. Falls are most common cause of traumatic brain injury in the elderly. So elderly people fall, and obviously they are on maybe clopidogrel, maybe on aspirin or febuxostat or whatever, right? So because of that, they bleed more than other people, and also their fall might be more, when we fall, we will put a hand or, we will try to break the fall. But when they fall, their fall will be, the momentum will be more. This is a nice paper done by Ranavira Fonseca and his friends, done in Sri Lanka. The topic is incidence and risk factors of falls among the elderly in Colombo district, a case control study which was done from 2010 to 2011. Participants were over 65, residing in the Colombo district and walking independently or with an aid. So they found that out of 1,185 participants, 13% had a fall during the 4 months of follow-up, right? So they have followed up almost 2,000 patients, and out of that, 13% of the people have fallen during the 4 months. And out of that 13%, 22 had fallen more than once during that 4 months. So you can imagine what the causes or what the morbidity is, right? The incidence rate of falls was 491 per 1,000 person years. So that is, so they have calculated this 13% or 152 for 1,185 people over 4 months. So they have calculated this into 1,000 person years. That is, if you take 1,000 people, 491 have fallen. So they have also found that females have fallen more than males. So there are different reasons for this. It can be we have a greater female population than male population, and also there might be other factors which can make females more vulnerable. Also, they have found that with age, right, the percentage, the number of people who fell increased, say 65 to 69, 70 to 74, like that. So it increased from 360 to 458 to 691 for people above 70 years, so 75 years of age. These are the risk factors they found among the elderly. Actually, this was a case-controlled study. So they followed up these people, and for each person who had a fall, they had a control of 2 people. Right? So what they found is the falls were associated with age, more than 2 chronic diseases, not 1 chronic illness, more than 2 chronic diseases, dizziness for whatever the reason, poor vision for whatever the reason, history of fall within the previous year, right, like I told you before, and poor mobility, lived in the house with high risk level. So they categorized houses into low risk and high risk, right, depending on what they have selected the criteria. We will discuss about it a little later. Also, epilepsy obviously will make them more vulnerable, disability, and risk-taking behavior. So if someone is taking alcohol, or when someone is advised not to do this when they do, so that is the risk-taking behavior that they have spoken about. So coming back to Sri Lankan population, you all know that Sri Lankan population is aging, right? We have, the over 65 population is expanding. Right? So in 2001, it was 10%, and in 2030, when we are rich and going to be better, it is expected to be 22%, right? So we are going to face more challenges. We are going to have more patients with all these issues. This is from WHO Global Report on Falls Prevention. Risk factor model that they have chosen. So there are behavioral risk factors, environmental risk factors, socio-economical risk factors, and biological risk factors. So this is a model that they have proposed, if I'm not mistaken, in 2022. Yeah, right? So behavioral risk factors, they say multiple medication use, excess alcohol intake, lack of exercise, inappropriate footwear. Environmental risk factors, poor building design, slippery floors and stairs, loose rugs, insufficient light, cracked, or the flow is not equal. Socio-economic risk factors, low income and education level has had an impact. Inadequate housing, lack of social interaction, limited access to health and social services, lack of community services, resources. Biological risk factors included age, gender, race, chronic illness, example Parkinson's disease, arthritis, occupational, osteoporosis, physical. Sorry, I can't see this properly. I'm too close to the screen, right? Physical, cognitive, and affective. No, I won't fall. Still not 65, so I have my senses good. Physical and cognitive, capacity. Right. So what will make a person more likely to fall? Right? One is lower body weakness. So what this means is, I don't know how many of you all can squat and come up without issue. Right? You can try that. That is, so squatting, this is what they call lower body weakness. Quadriceps, hamstrings, gluteal muscles, where you can go back and come up. This is very important, especially for elderly people, to get up from a chair, to get up from a bed. Then research has shown vitamin D deficiency. Vitamin D is very important, has come to the limelight recently, in recent years. So they have done a research and shown that people who were treated with vitamin D fell less, or their injuries were less. Obviously, I think if you are taking vitamin D for a long time, bones will be hard. Then difficulties in walking and balance. So with age, some people have difficulty in walking, and maybe because of the weight, maybe because of deformities, maybe because of cerebral issues. Walking and balance is very, very important. And all of us do this. Use of medicines such as tranquilizers, sedatives, or antidepressants over the counter, and also they go and buy over the counter medication. That is why we say home visits are very important. Otherwise, they won't bring what they are taking to when they come to see us, right? So during home visits only that we will be able to appreciate this. And also there is doctor shopping. I mean, here, not like in the UK, they don't have a particular GP. They will go from one to another, and different GPs will treat with different brands, right? The same medication sometimes. So we will have to make sure that we are not double dosing, we are not replicating the same medicine, and all that. So so we are responsible as doctors for this issue, and also over-the-counter medication. So some people will do a Lida Lanka Sangame talk and say, my mother, father, so was better with this. Why don't you try this? So what do the patients come and say? Okay, doctor, can I have this for my mother or father or whoever, right? Sometimes we don't explain, okay, we write, right? But which is not correct in sense, and because we have to go through the list and see whether that person is already on that or on a similar drug. Because they will always, elders, they will not be sleepy, right? So their kith and kin will always come and ask, doctor, can we have something to put this person to sleep, or make him her able to sleep, right? And it's a common presentation or complaint that we will get. Then vision problems. So vision can be affected in many ways, right? Pure and simple cataract can affect vision. Glaucoma is a big issue, and now we have diabetes, which is causing the commonest cause of loss of vision in the world, right? So that's why we have a big role to play in this by preventing complications in diabetes and get their vision back. Foot pain and poor footwear. So sometimes they come to us, or they might not come to us. They will complain of foot pain. They might have had a fall. They might have they might have had a fall or something, and they might have pain in the foot for some reason. All right. So without just treating the pain, try to see what has happened and tell that because of this pain, your balance might not be there, you might not put your weight properly on your foot, so you might end up falling, to be careful. Poor footwear, actually, you all would have seen, we like to have nice shoes, whatever, right? But when it comes to the elderly, they don't complain, right? They wear whatever is there, they say, okay, that's okay, I'm not going out, it is fine, right? But make sure that that person's footwear is better than ours, right? Because that will prevent a fall. Sometimes their slippers are worn out, their shoes are worn out, they have holes, because they are not going out. They say, that's okay, Puta, I mean, this is fine, right? But I think we have to look into it. We don't have to spend a lot if you know where to go and what to buy. Home hazards and dangers such as broken or uneven steps, throw rugs, clutter that can be. So you all know that even we have tripped over things in the house, right? Even this, something like this. And older person might not see. Wires, it might be rugs, it can be anything. So you have to be aware and you have to think consciously all the time whether this can be a hazard to the person in the house. Not only to us, anyone, especially if there are no, if the lighting is dim. These days, electricity is expensive, so we tend to switch off lights. Always try to have a night light when there is an elderly person. Because not like us, they can't hold their urine. Sometimes they are on medication which makes them pass urine. And they might have, incontinence, they might have to rush to the toilet. So they are totally different from us. We have to understand this and make that person's room comfortable, like this area, without any obstacles, so that that person can walk about without an issue. And these rugs, there are rugs which people sell on the road. They are quite slippery, right? They are made out of, if you have a rubber sole, then that's okay, right? But otherwise, there are rugs which are made out of cloth, which are quite slippery, right? So make sure that they are not in the path of that person. Right, so what happens when someone falls? Commonly, there are no injuries, but I think that term might be wrong, right? When these people fall, they might not say, okay, that's okay, I had a small, whatever, and I have some pain here and there, that's it, right? But every fall in an elderly person will have some effect, right? At least another chance to fall, right? So minor issues will be soft tissue injuries, sprains, contusions, and they are more prone to have contusions because, like I said, they will be on aspirin, clopidogrel, or whatever. And 20% or 1 in 5 will have major issues like head injury, right? Which can be from concussion to severe head injury, where that report said above 70, I think 40% of the head injuries, major head injuries are from falls. Obviously, we see more fractures of the hip, wrist, spine, coupled with osteoporosis, right? So these are major issues. And all injuries are compounded by increased bleeding due to anticoagulants, like I said. So this is also a very important thing. All falls results in post-fall syndrome, right? They are dead scared after their fall, right? They say, and especially if they have had injury, right? They say, no, 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 I can't go there. They become restricted to their room, their house. They don't want to go out. They are very, very scared. So this causes, dependence, loss of autonomy, confusion, immobilization, depression, like that. So I had this patient. She is, I think, 78 or something. She was on antiplatelets. She had a fall, right? What are the causes of fall, that medical things that can happen? She was, a happy-go-lucky lady going about, but she had a fall. And she had a big bruise on the face. Luckily, she had a pelvic fracture, right? And so now she's dead scared. She went into depression. We started on antidepressants, and so her salts went down, sodium went down, which promoted more falls, right? So she is still now recovering, but this is the problem of she's dead scared to get out of the room, and she has a caretaker. She's scared that caretaker might go, right? So a lot of problems come when an elderly person falls, right? So we are still trying to get her back to, to get out of the house. We have given her confidence, we have told, but it is very difficult to move these people from their room. So, are there any protective factors? What can we do? I mean, we are all supposed to be young, right? What can we do to prevent falls, at least us falling, right? What we need is a behavioral change, first of all. So it's a healthy lifestyle is a key ingredient to encourage healthy aging and avoid falls, right? So what we tell our patients, do we do it? Not smoking, having a healthy diet, not to have, avoiding medicines also, I think, should be a factor, though it is not stated anywhere. So we have to plan now to avoid diabetes, cholesterol, or whatever in the future. We have to avoid obesity. We have to be active. We have to be, as doctors, I'm sure that we sit for a long time, right? So which is not very, very healthy. So we have to start that. Then we have to be conscious about the environment, like I told, not to have wires, not to have things going on. And especially another thing is pets, right? Especially dogs, they run around. I mean, they don't know who's above 65 and not, right? They run around because of the love, but many people have fallen because of pets, right? So we have to keep the environment safe. So these factors have been shown to be effective protective factors, right? So falls can be prevented by screening for risk of falls, reviewing medication, vitamin D supplements, strength training and balance training. I don't know how many of you all are exercising, doing any strength training, balance training. How many of you all can stand on one foot and wait for a minute, right? So international research has shown that Tai Chi is one of the better forms of sport, we'll say. And you all know that Japanese people live for long, and even at 80s or 90s, they do this. chair exercise, it is just to get up from the chair, go 3 meters and come back, right? I'm sure some of you all, when you all get up, your knees will crackle and, you know, have that, because we are not, our knees are not so healthy. I think any form of exercise is better than doing nothing. And then check vision, we have discussed. To wear proper footwear, we have discussed. Making the environment safer, we have discussed. Adequate lighting, no obstacles. And also when you have elderly people, the toilet is a very slippery area, right? And the person is also with soap and water and all that. So grab bars, where you get bars, right? So that if they are about to fall, they can hang on to it, or they can hang on to it and sit and stand and do whatever they are doing. Another thing very important is education about falls. We have to tell the person, the family, and the caregiver. And we have to plan early and manage medical conditions so that they won't develop visual issues, they won't develop peripheral neuropathy, foot ulcers, or whatever. So as family physicians, what can we do? We can do screening of people over 65 years of age and assess their risk and tell them, okay, go and get this done, or we have to manage you. Vision is an important thing. Postural hypotension, I don't think that we check for postural hypotension. We think sometimes, we don't manage it as postural hypotension. We don't diagnose it as postural hypotension. We will say, oh, there is dizziness, so don't worry, and all that. So salt is a very important thing, remember, in the elderly, sodium level. And we can also examine the feet of patients with peripheral neuropathy. We have to have a good control of medications that we are, medical conditions that we are managing. And opportunistic health promotion on falls, because if someone falls, we have to make sure that that person does not fall again. Right, so we can do, and this is only us that will be doing it, home visits to assess the patients, selected patients, right? Which no other specialty does. We can visit the patient, we can see how the patient is, we can see the environment, we can advise on, though they think that it is going to be expensive, we should tell the caregivers or the family that if the person falls, it's going to be more expensive, right? And we can organize community awareness and educational programs, and we can share knowledge among our colleagues, right? This happened to my patient, that happened to my patient in different forums. We can bring this forward because we are going to have a lot of patients in the future. Right, so wish you all a fall-free future. That's a very hopeful wish. Any questions that I can?
Thank you, Asela, for your informative lecture. Any question, please?
Sir, I was wondering about the vitamin D supplementation. How do they say to give it for at-risk populations? So, post-fall, do you give it to everybody, or is there a specific thing in our context?
That research was not very specific. They have given for over 65 years of age, and they have compared. Right? They have not given it to after a fall. And so they have, it was done in US or some place, right? They have given it to people over 65. I think now, if I'm not mistaken, like this aspirin, or when it came, everyone in the US was taking aspirin above 45 years of age or whatever the risk. Like that, vitamin D has come forward and they are taking it.
So we can supplement it to everybody over 65?
everyone is taking, I think now. We can, I mean, our next speaker also can tell something about it. Vitamin D supplementation and,
Asela, I have a question.
yeah.
Yeah, now thank you very much for the wonderful presentation. My question is, now you said there are, in some patients you get post-fall syndrome.
Yeah.
And how are you going to manage that? Because we come across so many patients with this problem.
Yes, so I think if we, after the fall, it's very difficult to manage because they go into that cocoon, they are scared, they go into depression, right? So if we start telling them, okay, this can happen, that can happen, right? So they are careful, right? And they will see, then they will say, okay, doctor, I mean, yes, you told me and this is what happened. So they might not be so scared after that. But we have to do, if it is after fall, it's very difficult to get these people out because then they lose their confidence, they lose their muscle power because they are not moving at all, and they go into depression, or then medication comes in, medication cause havoc, right? So that's why, I mean, it's a process of prevention is the best, so that, I mean, we can tell them, okay, that's okay, I mean, so we will manage the rest. Sorry, I hope there's no specific treatments as such, but it's all, doctor-patient relationship and managing people before they fall.
Yeah, just to add the question, because they asked about the vitamin D levels, and you cannot give vitamin D, I mean, like haphazardly. So there's a high chance of getting toxicity as well, and because of that, after according to the deficiency, we have to replace it, not like the way we want to give vitamin D.
Yeah.
Okay.
So vitamin D, you have to check the levels. If that it is less than 20, if I'm not mistaken, you have to give. But I think they checked the vitamin D levels and only they supplemented.
Sir, thank you very much for your excellent presentation.
Thank you.
And you mentioned about the vitamin D supplementation for the prevention of fall over the 65 years. How about, sir, supplementation of calcium with the vitamin D? Is there any?
I think they have given calcium also, because vitamin D alone is not going to help, right? But they were focusing on vitamin D. I think it was also supplemented in those people. Sorry, I forgot to mention that.
Asela here. Now you mentioned about the WHO prevention fall, that factor. Now is there any national level program to prevent falls?
Sri Lanka?
Yeah.
There was a document, but I am not really sure that we have a set plan. There was, I mean, it's there, I think, but I don't know whether it's has gone into implementation level. Actually, in that WHO thing, what I noticed is they have not mentioned vision, right? So I don't know whether it has come under some other topic. Did I answer your question?
Yes, yes.
Yeah.
In absence of question, we can wind up the session. Thank you.
Thank you.
Now I call upon the chairpersons to present the speaker with a token of appreciation.